Yes, sir, we are good to go.
Okay, so very good evening, everyone, and I welcome you all for another exciting program under the flagship of Indian Society of Pediatric and Adolescent Endocrinology. And today we are going to discuss two very important topics that are the usual concerns of all the parents for their child. They are concerned about growth, which includes both the height of the child as well as the weight, as well as the puberty. So we have with us two experts, and I am your host, Dr. Hari Mangtani. I'm a consultant pediatric endocrinologist and a growth specialist practicing at Nagpur. And I would like to introduce Dr. Preeti. She is from Delhi, and she is an associate professor in Lady Hardinge Medical College Department of Pediatrics, New Delhi. Welcome, Dr. Preeti. She is one of our experts. And with me to host this program, I have Dr. Divya Lakshmi. Dr. Divya Lakshmi, over to you.
Very good evening, everyone. I'm a pediatric endocrinologist and associate professor from Chennai. I work at Ramchandra Medical College. So today we have the expert speaker. Apart from Dr. Preeti, we have Dr. Shaila Bhattacharya. I welcome ma'am. Madam is president of Indian Society of Pediatric and Adolescent Endocrinology. Madam is also professor at Department of Pediatrics, JJMC Davangere, and pediatric and adolescent endocrinologist at Shivjyoti Clinic and Manipal Hospitals, Bangalore. She is also a convener for Pediatric Endocrinology Fellowship in the Institute, and she have authored several chapters in endocrine and pediatric textbooks and published original articles in international and national indexed journals. So I think with this introduction, we'll move on to the today's topic of interest. So to the first question I would like to highlight is the, what is the importance of knowing about growth disorders and puberty problems in children. Because I just want to give one small introduction, because every year the International Pediatric Endocrine Consortium conducts Growth Awareness Week in September. So a week in September is considered to promote awareness towards growth in children. So I want to ask Dr. Shaila ma'am regarding why it is so important to know about the several growth problems and puberty problems in children, and what is the importance of it, because this is being today's topic of interest.
Good evening, everybody. Thank you, Divya, for the kind introduction. See, if when adults come, they can tell their problems. Whereas when children come, they can't tell their problems. So the growth charts, or the growth, basically the growth of the child is a window for the health of the child. So once we know how the child is growing, by height and weight, and how the child, even the developmental motor aspect, walking, talking, then we know how the child is doing well. So growth is very important, because if child is having any diseases, we can pick it up early if you are doing a growth monitoring. So growth monitoring is the key thing for the child's holistic or well-being of the child. So growth is always the best indicator, and everybody should be monitoring growth, not only the parents, pediatricians. I think many times even the grandparents in the family tell how the child is growing. Even if the child is growing very thin and short, then they would always compare their parents, telling, you are also like this way. But is that enough? Because we have moved much forward in this last 2 decades. So if the child is small, can we attend? Because that can really psychologically, emotionally, physically, everything can affect the child. So I think if we talk to the child about growth, then we can pick up the problems early, and we can get some solutions much earlier than getting delayed and where there is no solution. Similarly, puberty. Puberty is lot of children come to us now, especially after COVID. The normal puberty is after 10 or 11 years in girls, and it should be after 12 or 13 years in boys. But we get much earlier. The 6-year, 7-year, 8-year-old are coming with either the underarm hair or hair below or breast enlargement or sudden problems. Even girls at 8 or 9 years are having periods. So can we do something for these children? So in next an hour or so, as and when questions come, and we'll try to solve these problems. And we want all parents to have awareness about these things, because many times even the doctors wouldn't be able to pick this up. So parents are the best people to pick early and find the solutions. So I think growth and puberty monitoring is very important, other than regular vaccines in children.
So thank you, madam, for that answer. So that sets the ball rolling, and we are going to discuss about stature first, that is height, followed by, I think, obesity, and then puberty. So coming to the stature, the cause of concern always is short stature. That means the child is, yeah, Divya.
So any questions for the delegates who have joined? Like if you have any question, please put your questions in the chat box. We will take up the questions towards the end of the session. Thank you.
Yeah, thank you, Divya, for that. So we will start with stature, and the cause of concern is always short stature. The child is short. So that is the primary concern of the parents when they consult us. So Dr. Preeti, if you can tell something about what is short stature, and as well as if you can tell us something about growth charts, as madam mentioned that we have to actually to find out whether the child is short or not, we use this tool. So please elaborate on that. Thank you.
Thank you, Dr. Hari, and I really thank ISPAE, Dr. Shaila, for taking up this initiative. This is something which is extremely important, because parental awareness is something that is going to be the the decider of the outcome of these children. Because unless we identify, we recognize, we will fail to seek medical opinion. So moving forward, I think ma'am beautifully elaborated the importance of growth and the growth of a child. How do we actually assess the growth? So for the assessment of growth, what is important is we need to measure the weight, we need to measure the length. Length is specifically done for children up to 2 years, and we also need to measure the height of the child. So length and height is something which are always almost synonymous, but up till 2 years we measure the length, and after 2 years we measure the height. And to know exactly whether your child is growing well or not, your doctor will actually check the weight, the length or the height and the head circumference, and then it will compare with what? With the expected for that particular age and gender of the child. And for that comparison, we use the growth charts. So growth charts is a very important, simple tool that is available with us that can be used even with the parents. But what is important is that whenever you go to the doctor, assessment as well as recording, both are equally important, and serially recording is something which is going to be the most important factor. Because any faltering in the growth is actually the first sign of any kind of a systemic illness, even before the signs and symptoms arise. So, but for deciding, for actually recognizing or identifying the growth faltering, we need to monitor, we need to assess and record it on a growth chart. So, madam, if you can really share the growth charts.
Yeah.
So growth chart is actually a simple graph in which what happens is all the body parameters, as I told you, the weight, the height or the length, and the head circumference, they are plotted at the age at which the assessment is done. So what you can see is a growth chart here, which is blue colored. Blue is the color given for boys, and pink is the color which is given for the girls. So what you can see at the top is written is 0 to 5 years, WHO boys, length, height, weight, and head circumference charts. So this means that these are the charts which are meant for the boys to assess the weight, the length or the height, and the head circumference. Similar charts are available for girls in pink color. So this is one thing which we need to know. Now on the growth chart, what you can see are the two axes. One is the x-axis and the other is the y-axis. On the x-axis, on the left-hand side, if you see, what is given is the age in months. And on the y-axis, if you can see, in the lowermost column, we have the weight of the child. In the middle, we have the head circumference. And at the top, we have the height or the length. And what are these lines? So the lines are actually centile lines. Okay, so these are the lines which tell you what is normal and what is abnormal. Okay, so if you try and plot the parameters with respect to the age of the child, that is the weight, the head circumference, and the length, the point at which it lies will tell you whether it is within the normal range or it is beyond the normal range. Okay, so what is normal? Normal is something which is expected with reference to a population, that is as per the age and the sex of that particular population, which has already been kind of elaborated on a growth chart. And what you see are the centile lines. Going from down, we have the a line marked in red, then we have a line marked in yellow, and then we have some black lines. Okay, the line marked in red tells you the lowest mode, that is the first centile. The line marked in orange will tell you the third centile, and the above we have the 50th and the 97th centile. So something which is between the yellow and the black line would be considered as normal. So if your child's growth parameters lie between these two lines, that is something called as normal as per the age and the sex of that particular child. Now, something what we need to understand is any point of time, if the child is lying at a point which is below the yellow or below the red, that is something which is of concern to us, and this requires evaluation by a doctor. Okay, I hope this is clear. So when we measure the growth parameters, it has to be assessed properly by a doctor and then recorded on a growth chart. Now, moving forward, after the age of 5 years, there are another group of charts which are given by the Indian Academy of Pediatrics. Okay, the earlier charts were the WHO charts, and these are the IAP charts. Again, we have two different charts. On the left-hand side, we have a chart that gives you the age on the x-axis. This is in years. And on the y-axis, we have the another centile lines, group of centile lines to describe the weight and the height of the child. Now you can see there are a lot of centile lines which are given. Again, you have the blue for the boys and pink for the girls. Okay. So you have 7 centile lines, and you can see that the lowest is the third centile and the topmost is the 97th centile. Okay. So anything that lies between these two lines means that is commensurate with the population. That is almost 95% of the children would lie between these two lines. Only 5% of the children are going to lie either below the third centile or above the 97th centile, and that is something you need to be of concern. Okay, on the right hand side, there are extremely important charts which are given, which are called the BMI charts. What is BMI? BMI is actually weight divided by the height of the child in meters square. That is an approximate measure of the nutritional status of the child. Okay, in today's, after the COVID pandemic, we have seen that children have experienced accelerated amount of weight gain, and they have either reached in overweight or obese criteria. Okay, so very important that at every visit, you need to also calculate the BMI and see whether your child is falling within the normal range or above the normal range. So you can see two important lines. One is the orange line and the other is the red line. So a child who is lying between the orange and the red line would be considered as overweight, and somebody who is beyond the red line would be considered as obese. And these are the two important things which we need to be very aware of, because obesity is something which cannot be treated. It is something which needs to be prevented. And for prevention, you need to be aware where your child lies and when to start. So where you have to start earliest at the point of identification. So this is one thing. Now, Dr. Hari also asked me about the question about what is short stature, because a lot of children come to our OPD complaining about that the child is short, the child is, as compared to his peers, the child is looking short. So first and foremost step is record the height or the length of the child and plot it on a growth chart. Okay, so as you have seen, you have a slide where you can see that the child's weight as well as the child's height, both are lying below the third centile. Okay, so the child's weight is also less as well as the height of the child is below the third centile. So two important things which we can conclude are, as compared to the population, this child is definitely short. Okay, so this child is short. Why? Because the child's height is lying below the third centile. And if we try and look at the weight as well, the child's weight is also lying below the third centile. So this child is both short as well as underweight. So this is the interpretation we can get from this growth chart. Now, second important thing which I would extremely emphasize is, please preserve this growth chart. At any point you visit the doctor again, please record the height and weight again, specifically at an interval of 6 months. Why? Because we want to longitudinally track the growth of the child. Okay, this is extremely important. What we expect is that every child between the age of 2 years up till the time the child enters into puberty follows the growth trajectory, which is parallel to the centile lines. Okay, so if a child is lying at 10th centile, he would very well continue to lie at 10th centile. Any jumping of the centiles that happens between 2 years till the onset of puberty is something which we should be concerned of and is required for evaluation. I think
Thank you, Dr. Preeti, for that elaborate discussion over charts, but let me summarize it. Anything above the lowest line, below the lowest line is short stature. That is what on growth chart. I mean, that way, that is the easiest way one can remember this. So, yes, Divya.
Yeah, thank you, Hari. So
before we go to the next question, I want to really emphasize here, growth charts, we are talking so much, but parents may not be aware of these growth charts because many doctors do not give these growth charts. So now this is the right of every child or a parent to ask for the growth chart, because in a busy clinic, the doctors do weigh the child and write only the weight, but never the height is measured in many clinics. So I think this is the best opportunity for you all, and minimum of 6 months, at least there should be one height of the child. So in a year, we require at least 2 heights for the baby or the child, so that suddenly if you come at 10 years, we have only one height, then we cannot compare what was the child growing previously in last 10 years. So if we have two heights in a year, then that would be really helpful, and then we can tell whether the child is short or the child is been better than last few years. So please, whoever the parents are here, please demand the growth chart from your busy doctors. The doctors who are here listening, please adapt and give the growth charts to every child you see. Thank you.
So I think all the parents and the doctors who have joined has an idea about what is short stature now. So I'm putting forward the next question to Shaila ma'am regarding what are the common causes of this short stature, ma'am? What are the problems that can cause this height being blunted height or short stature?
Yeah, the thing is, whenever you are short, like what Dr. Preeti showed in the chart, I'll just go back to that slide shared. You can see here, the height is less, so you are calling short stature, and the weight is also less. If you see here, weight is more affected than the height. So this weight is affected means there is some problem in the nutrition. So the most common, whatever we talk in India, the nutritional problems are more common. So the first and foremost thing is malnutrition. We will talk about the other aspect of malnutrition. This malnutrition is low nutrition or less efficient nutrition. So the child's weight is low. This is causing short stature. There are a lot of other causes which can cause short stature, like if the child is having any chronic diseases. For example, nowadays, a lot of children do have asthma, or if they have chronic diarrhea, if they have anything called as wheat allergy or gluten intolerance, celiac disease, they can have. If they are having any cardiac problems, any GI problem, anything, then they can have short stature. These are the main chunk of problems for short stature, which we should think of before jumping into hormone problems. The next is if there are any bony deformities, we need to see that. Again, the doctor will check and tell. Then the next is, as endocrinologists, we want to emphasize on the hormone deficiencies which can cause short stature. Two most important thing. One is the most common one, second is the less common one. The most common one is the hypothyroidism. So this can be acquired. That means after 2 or 3 years, the child develops hypothyroidism, or it could be a congenital hypothyroidism when the child is born, we make a diagnosis of hypothyroidism. So the major cause could be hypothyroidism, which we need to check at birth. So if your child has not had a thyroid check, if there is a strong family history, your child is short, you all have to get your child's thyroid test done. Second is growth hormone deficiency. So once we do all the basic investigations to rule out the systemic causes, like what all the diseases and the nutritional causes, renal causes, then we will do a thyroid test. If that is also not there, and if the child is severely short, I will show in the, you can see here, the child is very short and the weight is okay. So it means the nutrition is not there, but the child is short. So we need to rule out all the systemic causes and then thyroid problem. And then if thyroid is also normal, then we go for the growth hormone testing. So that would be the causes for short stature. And never forget, I have also marked something here. You can see here, this is called as mid-parental height. So this is if the parents are available, many times only father comes or mother comes, but as much as possible, you need to get both the parents' height. And we have a formula to calculate, and we put this formula here, and the expected height of this child is supposed to be here, which is around 170, because the parents are tall. And then we extrapolate this line to here. So the child at this age should have been 120, but this child is 100. So definitely there is something going wrong in this child. So we need to attend to it. So this is nothing to do with the short parents, because parents are quite good height, but child is short. So we need to rule out systemic causes, nutritional, systemic, thyroid, and then last is the growth hormone deficiency.
Thank you very much, madam. Madam, one more question which all the parents are concerned about, that my child was born short. When he was born, he was only 1.5 kilos and he was very short, thin. So what happens to such kids? I mean, can this be a cause of short stature also?
It's a very good question, Hari. Because nowadays we see now in last especially in last 10 years or 20 years, lot of our preterm premature babies are surviving. They're all small for date or IUGR. If you take 100 children, out of 100 children who are born small, 80 to 90% will catch good weight and good height by 2 to 4 years. But there is that 10% which don't catch up both the height and weight, and they remain short. And it can be so severe if they are not attended, then they can be only 130 adult height in girls and 135 adult height in boys, around 14 to 18 years. So that 10% should be really looked or caught from beginning. They should be followed up. If they don't catch up, they should be evaluated. And the need, these children, if they are given growth hormone, they can definitely catch up growth, and they can have at least some decent height in the society, which will not affect them psychologically. So these all these IUGR and SGA babies, everybody is worried only at that time. First 6 months, they are very worried about the height, weight, everything, hypoglycemia, nutrition, this, everything. But after that, they forget.
In fact, these children are also like at risk of becoming overweight and
absolutely. Because the other thing is, they at that age, they start comparing their kid with the neighbor's kid or the sister-in-law's kid or somebody's kid. The same 1 year old, mine is 7 kg, my sister-in-law's kid who is 1 year is having 10 kg. So they will start feeding all the non-essential Pediashoots and all the things. So then the child starts gaining too much of weight and land into early puberty or precocious puberty or adrenarche, what we call. So we should not chase the lines also too much. You need to go fairly in a decent line and never compare your kid with somebody else's kid. But it is a double-edged sword. If you don't grow also, there is a problem. If you overgrow or overdo anything, that is also a problem.
Yeah, so
And many times, mother only comes, father only comes. So is it all right? Like, the parents say, मुझसे ना वो 4-5 inch height होगा, ज़्यादा होगा, like that. So I mean, can we take that as this one? I mean, like approximately take the other parents' height. Is it all right, or should we ask both the parents to come?
See, many times both parents don't come.
Yeah, that is
So
what
we will have to take approximately and calculate the mid-parental height, like what I said. But sometime the other partner will always come. So that time you should make use of that opportunity and recheck and recalculate and remark it. That is the only way we can do. Many times they don't come. They all want to come on a Sunday when it is our family day.
Absolutely.
yes, an important takeaway from the discussion, I think, is those who are listening, if their child or if they have seen someone in their family who is born short and was requiring an ICU stay for say 10, 15 days, 20 days, and still is looking short, don't wait for a long time, and please consult your pediatrician or your doctor or a growth specialist directly. So after this discussion about short stature, the causes, and what are the tools which are used by doctors, usually like growth charts, to come to a conclusion of the cause of short stature. Dr. Preeti, can you tell us, the audience here who are the parents of child, that how they can know that the child is growing normally by, can you give few easy tips which they can follow and make out that the child is growing normally?
Yes, yes. So I think one has to be aware about the anthropometric parameters as we discussed right from the time of birth. Okay, so the first and foremost opportunity you have is the birth weight. So record the birth weight, the birth length. In fact, that is extremely important for children who are born preterms or SGAs. Why, as ma'am told, that almost 80% would catch up, but what about those 20%? So for that 20%, it's extremely important that we keep monitoring their weight as well as the length. And the third important thing is the head circumference. So growth is very predictable. Okay, so for the first 2 years, the body experiences an exponential growth in all the domains. That is the weight, the length, as well as the head circumference. So suppose the child is born around, an average child would weigh something like 3 kg. So what we expect is that the child weight would double by something like 5 months, and then it would triple by the age of 1 year. Okay, so this is something which is a predictable pattern for a child who is born term and who is of average build, and would quadruple by something like 3 years. After 3 years, the weight gain would be something in the range of 2 to 3 kgs per year. If a child experiences a weight more than this, then we have to be worried. Okay, so and very important to remember that the growth happens in bursts, okay, in spurts. So it is not a uniform pattern that, okay, from January till February, the child will gain this much, and then from February to say March, the child will gain. No, this happens in spurts, and that is the idea that we do this kind of a growth monitoring for something like every 6 monthly or yearly, because we don't want to measure, we don't want to keep calling our children every month. So for first 2 years, what we advise is that utilize all the immunization visits, which starts from birth up till the age of 2 years. Maximum, most of the immunizations happen at that time. So all those visits should be utilized to measure the weight, the length, and the head circumference. If you talk about length, an average child is born with a length of something like 50 centimeters. What happens in first year is there is an exponential increase in length, something like the child increases up to something like 75 centimeters. So from 50, the child is reaching till 75 by the end of 1 year. And by the age of 2 years, again, another 10 to 12 centimeters is added. But after that, the growth slows down, and that is physiological. So you don't have to worry, because people might consider initially the child was growing so well, but now suddenly the growth has started faltering. No, this is physiological. So till 2 years, there is an exponential gain. After 2 to 3 years, the growth slows down, and it follows a predictable pattern of something like 5 to 6 centimeters per year till puberty. And once the puberty initiates during adolescence, again, there would be a growth spurt. The child can, during this growth spurt, the child can gain something like 25 to 30 centimeters. Okay, that depends upon when the puberty starts for children. So this is extremely important, and this is predictable. Same is for the head circumference. So for first 2 years, 90% of the brain growth happens. So very important to monitor the head circumference because it is linked with the growth of the child. Growth and development, they go hand in hand. Any child with growth faltering will also have faltering of the cognitive and brain growth. So very important to monitor the head circumference, which we usually do every 3 monthly in the first year, and then again up till 2 years, and then we can do it something like yearly. That need not be done at every 6 months. Okay, so this is the usual pattern. So if a child is following this kind of a predictable pattern, that the child is probably doing normally. And for this, growth chart comes to our rescue. So if you have this growth chart, you will have a visual, utilization of where the growth parameters are lying. And very important thing, which I told you previously as well, that child follows the growth trajectory. So if the child lies at 25th centile, the child grows in the same trajectory. Please do not compare with the child who is at 50th centile. Okay, ऊपर वाले बच्चों से compare नहीं करना. So you just you should remain happy, accept how your child is doing, because that is also a healthy child who is just following the growth trajectory.
Okay, thank you, Dr. Preeti, for that. But madam, please add on.
Yeah, what Dr. Preeti is telling is perfectly all right. And I said, don't compare your child with neighbor's child. Okay, but this can be sometimes wrong, because if your child is growing well and same age, at least nearly the child should be the near height. They should be comparable height. But when the parent should be worried is few things. One is, if your child is not growing well, if the shoe sizes are not increasing for last 2 years, 3 years, the same 2 size number is going on. So it means child is not growing. Many people may not have access to the growth chart, or their doctors may not have access, or they may not have time to do it. So the simple things what the parent should notice, every year the shoe size should change, the clothes size should change, and the child should be at least little bit in par with the neighbor's kid who is of the same age and date of birth also, because some children may be in the end of the year, some children may be in the beginning of the year. So that 1 year should be counted. But if they are not changing their sizes and they are not able to reach the school pegs where they have to hang their bags or coats or whatever, where the other kids are able to do, or if the child is shortest in the class when compared to the other children, then I think the parents should approach the doctor directly, because many times parents are the best detectives and they only can reach the doctor and find solution. Yeah.
Thank you, ma'am. So my question to you now is, many times patient comes to us with only, some problem, right? Any fever, cough, cold or something like that. Even at that time, if we say something also like, there is some acute issue that is going on, and at that time they'll say, yes, we'll come like that. So, in other words, what I'm trying to ask is like, is it necessary, like, or it is important that the parents come to us? Like, suppose if there is one episode of fever 6 months back, and now only they are coming, like 6 months to 1 year later, another episode of fever they are coming. So, is it necessary, or like, is it necessary that the parents should come for a well child visit? They should meet their pediatrician, like, every few months once or so. Is it important? Like, what is your idea on that?
As I said, we have wellness clinics or health checkups when you are 30 plus, 25 plus, right? So that time you are doing annual checks for all your hemoglobin A1C, your cholesterol, blood pressure, thyroid, everything you do. But the same thing is right now not there in children. But I think we all should aim for this wellness clinics in children. So we should emphasize growth in these wellness clinics and ask them to come at least once in 6 months for a general checkup or a growth monitoring. If in case they don't come, like what you said, whenever they come for their other acute illness, plot the chart and tell them that the child is not growing. Once the child is better, please come back for this issue. Because at that time, if you are talking about growth, they will get really upset with you. So better to tell them, and at least our job is to educate them. Your child is not growing, so please take care of the child. If you want to know more about it, please come back. Then we will do tests and tell you what. They will definitely come back because they are very much concerned about the growth. But once in 6 months is mandatory for the growth monitoring.
Absolutely, madam, because we all know that after the age of say 5 or 6 years, the healthy period starts, and up to 15, the kids, they do not suffer from any acute illness and they might not visit a pediatrician for those 10 years. So a well child clinic or a normal, just a routine check, at least 6 monthly or a yearly should be done to just monitor growth. So in that line, I would like to ask Dr. Preeti that when should a parent or when should the concerned parent should visit a pediatric endocrinologist or a growth specialist directly for the growth of their child?
Yeah, I think extremely important. As ma'am said, that once in 6 months in a well child clinic will be extremely important to make a note of all the growth assessments and the records we have. And in case the child is short with respect to the children of the same age and gender, or in relation to the parent's height, that is the genetic potential, that is the time when one has to visit the doctor. Number two, as ma'am showed beautifully on a growth chart, that the child's height is affected as well as the weight is not that affected. There is probably an endocrine problem, and that is the reason why the child should visit endocrinologist. Then if you have an excessive weight gain in a child, okay, like I told you, after say 3 to 4 years, the weight gain is something like 2 to 3 kgs per year. And if the child experiences excessive weight gain, okay, that is again a point where the child should see an endocrinologist. Then growth velocity is extremely important. So that is also predictable, that after 2 to 3 years, the child gains something like 5 to 6 centimeters, as ma'am specifically told about the changes in the size of the clothing, the changes in the shoe size. These are important clues. If this does not happen, that is a point where you need to see an endocrinologist. So growth velocity is again something which is quite predictable till the time the child enters into adolescence. So this is something like 5 to 6 centimeters. In fact, you can utilize your wall, in fact, that we usually do for our kids also, that we keep, want to see them after every 6 months, 1 year, and see how well they are doing. So that is an important thing which you can incorporate in your practice. Then during adolescence, this is an extremely important thing. Why? Because growth and puberty, they go hand in hand. Okay, so this is a chart which ma'am has shown. I think this is extremely important. This is a BMI chart, and this is for specifically for children between 5 to 18 years. And you can see on the BMI chart, this child lies above the red line, that is above the 27 adult equivalent for the BMI cutoff. And this is clearly that this pointing that this child is morbidly obese. I would not even say obese, it is morbidly obese. And this is something of concern. And if it happens in the early life, this is even of more concern, because this looks like a pathological cause for obesity. So one has to go and visit an endocrinologist. And please, earlier we used to have those rhymes, chubby cheeks and rosy lips. I think this era is not the same. One has to be aware that health and obesity is not synonymous at all. Okay, so a healthy child is what we need to, urge for. We have to time and again look for the healthiness of the child and not for obesity or overweight. Okay, so don't keep pushing calories, and nutrition is something which we have to be aware of right from the onset at birth. We never want a child to be extremely chubby, because that can be unhealthy, and that can be a harbinger of complications later in adulthood. So this is extremely important. So excessive weight gain is again a point where you need to see an endocrinologist. And as I told you, the growth and puberty is something which is linked upon. I think we'll talk about it later also. So if you have an early onset of puberty or a delayed onset of puberty, that is again a point where you need to see an endocrinologist. So puberty is something I think we'll be talking about in the subsequent questions. So
Yes.
early or delayed puberty is again a point.
Puberty also coming in our way of discussion. And
I just want to add here, always when we talk about overweight or obesity, children, parents always tell, my child is healthy. I think this concept of that healthy has to be really dwelt very nicely, and that can be only achieved by showing them the BMI charts. If you don't show them the BMI charts, they will never trust you. So the BMI charts are very handy, and you should tell. And many times they say they are not our charts. They are all got from the abroad children. So we have to tell them that these are all our own children where we have done, and show them that healthy word has to go off from the mind in the look wise, but healthy should be in their diet and the other activities. Yeah.
So I think the last way to finish off with the short stature, there is this myth called short parents will have short children like that. So a quick comment on that, Shaila ma'am. So is it correct? Like,
see, many times short stature is dependent on genes. Okay, so if the parents are short, children can be short, but still we need to rule out why they are short, what is the reason. But if they are short, so there must be problem in the parents also. So there may be some genetic problems in them. So they need to be followed up, and if required, even the short parent, short family, they may require growth hormone if they are severely short. So regular follow-up is required even in the short children of the short parents.
So, yes, madam.
Even if you want to really reach your genetic potential, a good nurturing environment is required. And that nurturing environment would require good emotional support, psychosocial support, and as well as the nutrition. As ma'am told, that malnutrition is something which is there. So to achieve your genetic potential, please don't forget the nurturing environment.
Yeah, so taking it further, I would like to ask Madam 3 straight questions because of the want of time. So what are the treatment options available if the child is found short? The second thing is many times it is said that exercise kar lo बढ़ जाएगा, लटक जाओ बढ़ जाएगा, and cycling, swimming. So which kind of exercise will increase the height of the child? And there is this thing which people are more aware of it now is growth hormone. So can you just briefly tell what are the treatment options available and how safe the growth hormone is?
See, when you talk about short stature, it is not equivalent to growth hormone deficiency. So we have to rule out all the easily correctable things which I mentioned previously. First, correct all those things and see how the child is growing. So that is why you need a good follow-up every 3 monthly, check their heights and see if there is, after you correct the deficiencies or their conditions, whether the growth improves or not. That is one thing. So the basic treatment will be the nutrition, healthy nutrition, whatever we have been discussing, and good physical activity, lifestyle modification, so that you don't put on too much weight. What is you're asking about exercise? Exercise is basically for your regular well-being. No exercise is going to help you in a increasing height. This is again a myth. So every short parent, short kid ka parents will tell, वो अभी हम अभी वो लटकाया है, वो रोज इतना 100 कर रहा है, 200 कर रहा है, but it is not going to help. Swimming, see, all physical activities are good for child's complete holistic well-being, but none of the exercises have been proved to increase growth hormone and help in his height. So all the factors should be taken into account. That would be the thing for the exercise aspect. The third thing you asked about growth hormone. See, growth hormone should be used when there is deficiency. I think we will only talk about growth hormone deficiency. If your child is short, just because child is short for your family, but child is within those 7 lines. If the child is more than 3rd centile, 4th centile, 5th centile, 25th centile, this child does not require growth hormone. Because lot of parents come to us for cosmetic reasons, social reasons to give growth hormone. I think we as a pediatric endocrine society, we should completely oppose it, and it should not be misused. It is basically a growth hormone abuse or misuse. So we should not encourage. If there is a growth hormone deficiency, which we do few tests and then prove that the child is growth hormone deficient, then we will give growth hormone. If the child is having thyroid problem, we give thyroid deficiency, we give a thyroxine medicine tablet. Same way, if there is a growth hormone deficiency, we will give growth hormone. And the problem with the growth hormone is it is only available as injection form and it has to be given daily. So, and also it is much costlier than thyroxine. So all these aspects should be explained, counseled to the parents, and also how much the child would grow with this treatment, you need to tell. Side effects. Anytime you tell hormone, the hormone is equivalent to steroid. It is also a type of a steroid, but it is not going to, it is not going to affect your side effects if it doesn't have any side effects if you are giving for the correct condition where you are giving for growth hormone deficiency. When you use the correct dose for the correct candidate, absolutely there are no side effects because we all have loads of children who are growth hormone deficient and we are using absolutely no side effects. But if you use large doses, then there can be problems. So large doses should not be given unless there are some few conditions which are indicated. Otherwise, growth hormone is safe, no problem. And if they are deficient, go ahead and give growth hormone.
Yeah, so I think as the knife is required to cut the vegetables in the kitchen, and it is the safest thing if the mother is using it. If it is in the hands of a child, then it is dangerous. Similarly, I think growth hormone in hands of anyone else except endocrinologist is a dangerous thing. That is what can be taken from this. Yes. So yeah, Divya.
Moving on to, I think, the weight perspective of growth. So I have a question to Preeti. Like, see, many times parents are concerned about, my child looks thin, wo to patla dikhta hai, dubla dikhta hai, like that, isn't it? So their major concern is regarding the weight. So you have already spoken about the appropriate weight gain, but can you just like tell in a short brief, like regarding what is the appropriate weight gain for a child?
Yes, actually, I'll just reiterate what I said before is that weight, good weight is not synonymous with the health of the child. As MAP also very well said that please defer using this term healthy hair baby, but the weight is going like more than the 23rd adult equivalent of BMI or more than 27th adult equivalent of the BMI. So please, if you find that the weight gain is something going beyond 3 kgs per year, you have to be really concerned, except for the time during the first 2 years or during adolescence. So those are the periods where the growth spurts would happen and there would be a lot of changes that would be going on. So at that point of time, yes, there would be some degree of weight gain, which would be beyond this range. But other than this, during the period, something between 2 years or 3 years till the adolescence, please, if your child gains more than this range, please be aware of it and you need to see a doctor why the child is gaining weight. So now coming on why the child starts gaining weight, this is something which we are experiencing after this COVID pandemic, right? So obesity or overweight is actually an interplay of the genes and the environment. And you really cannot control your genes, but you can control your environment. And what is this environment? Environment is actually constructed by the home, by the community, and the school. Okay, so when we talk about a healthy environment, this actually comprises a good healthy diet, a balanced diet. Number 2, it also comprises about how your child plays, the physical activity. Then what is the time the child spends in outdoor activity and the child spend during the indoor activity, that is specifically with respect to using the mobile phones, the laptops, the screen. So these are the 3 important aspects which actually determine the environment of a particular child. Okay, so if you look for this, all these 3 factors, these are the things which are disturbing the homeostasis and is probably leading to this obesity or overweight pandemic, which is happening globally across the world.
Yeah. Not only this COVID times, we have seen that obesity is increasing, and last 2 decades we have seen doubling in the prevalence or tripling in the prevalence of obesity. So that is what is a cause of concern. And why?
Not only that, we are having type 2 diabetes because of this.
Yeah.
We
So
are seeing as young as 6 to 7 years of age, we are seeing type 2 diabetes.
So I was coming to that only. So, Madam, Dr. Preeti, if you can elaborate, what are the consequences if the child becomes obese? Why we are talking about obesity and why we should be concerned about the weight of the child? What could go wrong if the child gains enough of weight?
Yeah, so a lot of metabolic complications, which we usually used to see maybe after the third or the fourth decade, are actually happening in the first and the second decade because of this, boom of overweight and obesity in children. So usually there is a phase, something called as obesity rebound. Okay, that happens somewhere around 4 to 6 years or even during adolescence. And what we are seeing is that this rebound of increase in the BMI is happening even earlier. Okay, so what happens is once the child starts gaining weight, the brain signals, and also sometimes what happens is because of the increase in the production of the peptides and other chemicals, the puberty starts getting initiated, and that is specifically seen in girls. Okay, because of the accelerated increase in the weight. So what happens is that the puberty starts somewhere, as we talked earlier also, that the puberty starts early, somewhere around 6 years, 7 years, 8 years. And that is going to have a tremendous impact on the physical health of the child as well as the psychosocial health. Psychological impact is also tremendous if the puberty starts early. Other than that, if you look into the other dimensions, the complications which start early are tremendous. Okay, and that is something multifold, and it involves almost all organ systems. Okay, as ma'am said, that what we see is impaired fasting glucose or even type 2 diabetes, what we call later on, that has started coming up even somewhere around 8 years, 10 years of age, which we never saw in our children. Then dyslipidemia, poor lipid profile, that has started coming up. That is, if you have increased fat deposits, the fat deposits occurs not only in the subcutaneous tissue, even in the visceral organs. So something called as fatty liver, what you have heard of. So that is usually seen in alcoholics, but if you have increased weight gain, that happens with children also. So that is very important that we should be aware of, because that can be a harbinger of liver disorders and liver pathologies later in life. So this is something which we need to be concerned of. Then poor self-esteem, because of the body image issues, the child has a lot of psychological impact also. The children can become anxious, they can develop anxiety, depression. That is also extremely important. Then the arthritis, the bony problems, that also starts coming up. So that is something which we need to be concerned of. And sometimes what happens is when you have this kind of a disorder, the obesity kind of a picture, children can develop hypertension, what we used to see somewhere in third or the fourth decade or maybe later on. So hypertension is again a problem which can start cropping up if the obesity develops early in life. So these are the primary things which we need to be aware of. And obesity is something which cannot be, you cannot treat it with drugs. It has to be prevented at any cost. And for prevention, you have to identify and act early. The earlier you act, the more would be the beneficial outcome. Otherwise, if you detect something like 15 years, 16 years, 18 years, already the complications have set in. So that is the point at which you can further, kind of prevent the progression. But what has happened cannot be reversed back. So that is something which is we need to identify and act early.
Yeah, absolutely. Well said, Dr. Preeti. And I would also like to add that it is the polycystic ovary thing which is becoming more common in obese girls, and then later on leading to infertility. So it has got health consequences for a long time. So one should be very aware about the child's weight gain. Since early childhood only, they should keep on monitoring. Divya, you had some questions about endocrine causes of obesity and all. Please go ahead.
No. Many times, parents come with, thyroid test report in their hand when they feel the child is gaining weight. So what your take on that, Shailam?
See, many people think, oh, my child has got thyroid, that's why the child is obese. But I think it is the other way around. Because you are obese, your thyroid tests are little bit or borderline abnormal. But this abnormality doesn't require thyroxine tablet because it will not disappear with that. Many children who are in that borderline 5 to 10, if they lose weight, that 5 to 10 becomes normal. So I would just tell, lose weight, repeat the test after 3 months. If you don't lose weight, it will stay like that way only. So better you lose weight, thyroid will, because people are very much worried about thyroid, but it is the simplest problem. But once you lose weight, your thyroid test will also become normal. So don't require treatment.
So since you have already started like lose weight, so how do we lose weight, in children? And, many times the parents ask, please give some medicine, let the child lose weight, like he's so abnormal like that and all. So what do you want to say to those parents?
Wish I had a magic medicine. Unfortunately, it is the most difficult thing to achieve. But if you are consistent and it is a full family approach, I think you can really achieve that point. So in children, we don't use any medications. It would be always a little bit of calorie restriction, more exercises, stop your screen time, especially your mobiles, because we don't tell now, don't watch TV because nobody watches television. Everybody is in their gadgets like iPad or mobiles. So, and then physical activity where whole family has to do, or even the diet. Nobody should tell that I am going to eat this nice yummy food and you eat this completely calorie restricted for children. So it should be the wholesome family meal, which should be calorie restricted and physical activity, cut down the screen. And now coming to, now everybody tells, oh, so much COVID is there, I can't go out at all. I can't go for swimming, I can't go for running, jogging, all these things. So I think you need to modify these things. Children love dancing. So tell them to dance 1 hour in the morning, 1 hour in the evening. So that will be real good physical exercise. Go for some yoga, Surya Namaskaras, breathing exercises, do some spot jogging, skipping, and tell 2-3 kids to play together, do all these things together where they would enjoy, and also it will be like a medicinal effect. So diet, exercise, and no screen are the mantras for achieving at least little bit of ideal weight.
Absolutely agree. So I think we'll move on to the last topic of the day. So
we should finish it
Preeti,
fast.
yes.
Yeah.
Preeti, so I mean, you might be seeing a lot of patients presenting with early appearance of pubertal signs. So just for the parents' sake here, can you tell us like what is called as the precocious puberty or early puberty?
Yeah, before we move on to the early or the precocious, let's first understand what is normal range of puberty. So most girls, they experience puberty in a range somewhere around 8 years to 13 years. Okay, so if I would put in very accurately, it starts usually at the age of 9 to 10 years. Okay, what is puberty in girls? The appearance of the breast buds. Okay, so when the breast bud starts appearing, that is the point where we can say, okay, the child has entered into puberty. For boys, similarly, the range is something like 9 to 14 years. And most of the boys, they enter into puberty somewhere around 11 to 12 years. And for them, the increase in the size of the gonads, that is the testes, that is the first sign, the clinical sign that you can appreciate to say that the child has entered into puberty. Now, we already are aware because of the environmental factors, some children go into early puberty. So early puberty is defined as any child who has puberty that happens before 8 years in girls and before 9 years in boys. That would be called as precocious puberty. Okay, so this is the term precocious. So precocious puberty, it may be idiopathic or it can be because of some organic causes. That is for the doctor to decide. But what we need to understand that if you have signs, clinical signs of puberty happening before 8 years in girls and before 9 years in boys, this is what is called as precocious puberty. Also, not to forget that if the signs don't appear by the age of 13 years in girls and 14 years in boys, that is also a point of concern. So we need to be aware of both the spectrum, what is precocious and what is delayed. Okay,
So
and
yeah, this was regarding the precocity. This is a pathological thing which we are talking. But madam, if you can tell something about early puberty, I mean, where we should draw a line, because there has been again a debate on this. Where should we draw a line and should be concerned? Because what I understand from this is 8 years we should look for the signs of puberty in girls and 9 years. But shouldn't we bother if it all starts at 8.5 or 9 years?
Yeah, see, this 8 years is a real arbitrary thing which we have extrapolated from Western people. But in our children, we really don't know exactly what happens when it happens. If it is before 8 years in girls and before 9 years in boys, easily we can tell as precocious puberty. But many times they come in between this 8 and 10, where they are completely not mature. See, and their parents come to you telling she's only in second standard or third standard, we don't want her periods to come. So you can't just tell, oh, our books say that 8 years is fine, so it is normal. No, I think you will have to see what are the reasons why the child, whether it is because of obesity or using of all these nonsense chemicals in the food, which could have triggered lot of estrogenic chemicals. We see that children who are 5, 6, 7 years, they use lipsticks and come. Because all this, even the lipsticks, perfumes, deos, everything are all adulterated. They all have got estrogen somewhere or the other. So I think all these things should be advised to them. If a child is having like 8 to 10 or 11, we call it as early puberty. If all these things are excluded or avoided, and if the child is short at that age, and if you predict that height, child is not going to attain the parent's height, I would always try and see if we can postpone the puberty with the parents' consent. I know it is not well accepted, but you don't want a short child, because we do get so many children who are 15, 16, 18, who are only 4.5. And if you take a history, they will tell we started periods at 9 years. My doctor didn't tell me that there are some options for this. So we have to give them options. Many parents will accept. There are some parents, they will say, no, this is normal physiology, let me go ahead. But our duty is to counsel them what is good, what is bad, what are the outcomes. Because we shouldn't, child would be emotionally affected. If the child is very short, with even though we call early puberty, and along with that, if short stature is there, and along with that, if there is a familial short stature, definitely child will be short, and it is going to affect the kid. So you have to think again, holistic approach, and take correct steps for it.
So is it true that, I mean, from what you have discussed, that we are seeing children in puberty early, so they are getting these hormones, this boy turning into a male or girl turning into female, these hormones, they are appearing early, I mean, especially in girls. What about the puberty in boys, madam? Have you seen, I mean, what is your take on that? Please can brief us.
It is not as common as in girls, but we do see a little bit of early puberty in boys. Many times, this is again a lot of environmental factors. So I think we need to rule out those environmental causes, but we have to think of some pathological causes also in boys, because any of the hormone changes in boys are most of the times they are pathological. So we have to rule out any disease associated with early puberty or precocious puberty, especially if they are boys. So that should be left to the doctors to decide, to investigate, decide, and go for the treatment.
I think I have one question. I think we wind up with that one question, I guess. So, ma'am, do you feel like if the child comes with early signs of puberty, let it be a girl or a boy, so what should be the next step? Like, if the parents notice that the child is having puberty signs, so what should be the next step? Does all early appearance of puberty signs require treatment? So just highlight about that
I think, as I said, we have to thoroughly investigate if there are any treatable causes, because if you say take even simple hypothyroidism can cause early or precocious puberty, and it can cause delayed puberty. So we may have to do the thyroid test and see that there is no problem. But if all the treatable causes are all gone, everything is fine, do a bone age. If what we say it is the skeletal development, if that is advanced, then if you are going to think that it is going to fuse early, if the child is short, I think the option of postponing puberty should be given. There are very best treatments now which have got no side effects. So I think that option should be given to these parents, and then they can decide.
And madam,
Hari.
One more thing which is commonly heard is that girl will grow after she has attained menses or menarche. So can you just
this is again a big myth, because they always tell, even including the pediatricians, gynecologists, obstetricians, they say, it's okay, your child will grow, anytime. Poor parents are approaching the doctors, but they are not getting correct advice. Girls who attain periods or menarche, I think they will grow for next 2 years, which would be not more than 5 to 7 or max 8 centimeters. Whereas the boys, even after puberty, they will grow, but it is not that they will be. Many times they also tell boys will grow till 20 years. But again, that is also wrong. Unless there is what we call late bloomers or constitutionally delayed puberty, they won't be growing till 20. Even they will stop growing by 16 to 17 years if they have attained their puberty fully. So the girls' periods, if they come after periods, then very less likely that they will have more height. So you should always tell them to come before they start their periods. Then only we can do something, act something, and make them a bit tall. Yeah. Do we have any questions? Otherwise, we can.
We have a few questions
after
as
all
well.
the discussion, what I could understand is a child who is short or has got obesity, or a child who develops early puberty, the most important thing they develop is the psychosocial issues of negative body image, low confidence, and poor performance. And beyond that, there are physical issues associated with obesity, which Dr. Preeti has elaborated, including orthopedic issues and issues with metabolism, that is the internal milieu, and also physical issues associated with puberty. And Dr. Shaila has pointed out that they end up short. It is more like a rabbit and tortoise race. They initially grow fast and then they stop, while the other girls who are gradually approach and they grow taller. So with this, I think treatment is also available for all these problems, and I would request all of those who are listening to this and have joined us should consult their pediatrician or a growth specialist or a pediatric endocrinologist nearby. They can approach directly if they have concerns about the height of the child or pubertal issues, or if they are concerned about the weight. With this, we have a few questions in the chat box, and I would like to ask, can any medication affect growth of the child? Madam, if you can tell, Shara madam, any medication that affect the growth of the child? I think someone must be on some medications for a long time and they are affecting the growth.
See, for example, if you are giving medications like even steroids for some other chronic diseases, for nephrotic syndrome, you think some kidney disorder, or from some blood disorder, or some bone problems. If you are giving for a long time, large dose, then it can suppress growth. So always growth monitoring is important whenever you are giving any medications. And as and when required, they will change. If the growth is affected, when you talk to the specialist who is giving the steroids, then they will change the medication and give some other medication which wouldn't affect the growth. So these would be the main thing is the steroid. Anything else, Preeti?
Yeah,
So,
correct. I think some antidepressants are also there which affect the growth, but primarily the steroids. And sometimes the chronic illness is something which we need to be aware of. That can also be one of the reasons why the child is not growing well. So if you are concentrating on the drugs, please concentrate on the underlying illness also. That is also extremely important.
yes. So, Dr. Preeti, one more question. Is it true that when the height is increasing, the weight will not increase? Someone is asking that at the time of puberty, only the height increases and the weight stops gaining.
That's not true. That's absolutely not true.
You can bust that
Weight
myth.
and height usually go hand in hand. But yes, the growth spurt that is there during adolescence, that is during puberty, is enormous. Something like over a period of 2 to 3 years, you will gain something like 25 to 30 centimeters. And the weight obviously will not grow to that extent, but you'll not gain weight to that extent. But yes, both the things go hand in hand. And what you actually end up is the lean body mass. If you are actually giving the right environment, the right nutrition, the physical activity, what you gain is actually the lean body mass, which would be extremely important and useful later on in life, because that is the only point where you have the bone mineral accretion going on during adolescent. So if you have the right nutrition, so you will not end up adding only the subcutaneous fat. You will have some important lean body mass, which would be in the form of bone mineral accretion and the muscle strength, which would be extremely helpful to maintain your metabolism later in life.
Absolutely, I agree with Dr. Preeti, but you should also keep in mind, this is an adolescent period. So if the weight is not going and only the height is going, any other emotional problems, anorexia, bulimia, body image problems can be there. So they may not be eating properly. So you have to again take good history, examine, counsel them for how much important nutrition is, especially during that time, for strengthening their bones. Like what Dr. Preeti said, should be emphasized. Just don't leave it without emphasizing that, because nowadays we are seeing a lot of psychological problems and body image, because everybody wants to look like a model. So that question may be appropriate. If the weight is not catching up with the height, you have to think some other things also.
Absolutely, ma'am. Eating disorders is something which we need to think about it.
Yes.
And one more question was there. Please tell the magical medicine, but this was posted when we were talking about obesity. So perhaps
I didn't see that question, but I did mention, because all parents ask this, so that's why I was telling. Give me some man. I always tell them, if it was available, I would have first used myself.
I mean,
absolutely,
yeah.
ma'am. There is no
We
magic
don't
medication
have any
to
magical
gain weight,
medicine. That is
and there is no magic medication to lose weight as well. So good, important. I think the message is the balanced diet, nutrition, which involves the wholesome diet of cereals, good amount of fruits, vegetables, fiber, micronutrients. These are the important components of a good, healthy diet. So one has to be aware of that.
Madam, I would
Last question, yeah.
remove that confusion. I mean, to improve height during puberty, taking steroids, how does it work? So I think there is some confusion here. If you can just clear that.
Yeah, we don't give any steroids. The body will produce their own hormones which are required for the growth during puberty. Absolutely, steroids are not indicated. And if you use steroids, then the height will be suppressed. Keep that in your mind. So don't use. Even the growth hormone is not used if it is not indicated. So please don't use all these over-the-counter available medications also, because all these things are not going to help. It's only your good physical activity, healthy nutrition, good sleep is very important along with all these things. Keep your mind calm and have a good sleep. If you're not sleeping, especially in children, younger children, good sleep is very important. There is the role of stopping these all these screens and all. I think you all would remember, all our grandparents and parents would say, if the child is sleeping, leave the child to sleep, let them sleep, because sleep is a stimulant for growth hormone in the younger age group. So I think good sleep is always very important for a good height achievement.
So I think because many of the gym trainers and they are promoting this steroids or anabolic steroids for growth and height gain. I think this all has to should be seen very critically before.
Recommended protein shakes also should be taken, whatever is recommended.
Yes.
Not 10 scoops every day, 10 egg whites, all these should be really banned.
In fact, gym itself is something which is not advised for the kids. So
Yes.
do not, go into this crash diet or crash weight loss using a gym or something like that.
Fad diet should be avoided. Fad, FAD, fad diet should be avoided. And gym is absolutely no till at least 16 years.
I think two more important questions come. I think we'll answer it very quickly. So a lot of parents whose children develop early menarche, they come for postponement of puberty to improve height. I think the important thing here is like by the time the girl starts having their periods, it is too late to improve any height. So you need to come earlier. So I think that is the one important point I would like to say here. And Madam or Preeti, like anybody would like to add up to that? Like,
yeah, Madam elaborated beautifully that one has to be aware of the early signs and come as early as possible, because once the menarche starts, so we have to put all the things in perspective. Yeah,
You missed the bus.
yes.
yes.
And there is one more question on this bone vita and other things. The worst one is the Pediasure. Next
Yes.
are all these bone vita, Horlicks, Complan, where they show that increment in the height. I think these all are only gimmicks of the companies.
Yes.
They absolutely will not increase. I can take bet, if I can challenge also, it is not going to help. So instead of that, give them healthy greens and vegetables and fruits, cut fruits and not juices or fizzy drinks. Your child will grow better, not with bone vita, Horlicks, Pediasure.
I think we can conclude the session. We had a very, energetic and enthusiastic discussion on several important, growth problems and pubertal problems. So I think for giving a vote of thanks, I would like to invite Dr. Mahesh Maheshwari, sir, Professor of Pediatrics from AIMS Bhopal. Over to you, sir.
Thank you, Dr. Divya. Am I audible?
Yes, sir.
Yeah. Thank you, Dr. Divya and Dr. Hari and ACES team for giving this opportunity to be a part of this important discussion in last 1.5 hours. And I think this is really a privilege to see how the ACES series evolved. I think I am the part of this series since the beginning. And initially it was a pure academic discussion with the national and international standards. And now we are going towards the actual people who are going to get benefited with these particular series. So, but before going on to the proper vote of thanks, I think there are a few questions on the YouTube channel. If you can permit, then maybe I can ask few of those questions that I can.
Yes, sir. Yes, sir. You can
do it. Yes.
Yeah. So there are one question is, what is the delayed menarche? Is 15 or 16? There is one person who asked this particular question. What is the definition of delayed menarche in a girl child? Yeah.
Preeti can take this.
If the
Unmute
child-
yourself.
Yeah. So if the child doesn't experience menarche till 16 years, we have to be worried. And one also has to be aware of the important signs of puberty, which we discussed, that if the girl doesn't have the breast bud development till 13 years and the boys do not have experienced the increase in the gonadal size till 14 years, again, one has to be worried. So these are the important clues, clinical clues to delayed puberty, and one has to seek opinion and visit the doctor for evaluation and management of the same.
I think by 14 years, if they don't develop any secondary sexual characters, you should see the doctor. Like your breast or underarm or any pubic hair, if you don't see, please consult your doctor. because it does require, and also they will take a good history of when your parents, aunts, everybody has had their periods, and then if necessary, investigations and treatment would be given.
Dr. Preeti, there is a similar question. If the mother is getting the menarche at the age of 15 years, what do you expect in the girl child?
Yeah, so usually the girls and boys, they follow their mother and father respectively with respect to the age of menarche and the age of shaving. So that is something which we ask for children who are constitutionally small and you have not entered into puberty. We definitely ask what was the age the mother started having menarche, and because it is to a certain extent linked genetically. So yes, that can be an extremely important clues for the late bloomers who have not entered into puberty, and that can be an important sign. But yes, this is something, the constitutional delay that happens is always a sign of exclusion. So we really don't take it on the face value. One has to see a doctor, one has to get the right opinion from a doctor before just, delaying the medical consultation. So, but to a certain extent, yes, they are linked.
Every rule has an exception, Dr. Mahesh.
Yes.
So if you see, many times we do see girls who start their periods by 10 years, and whole family, it would have started at 15 years. So along with the genes, there is something which is acting on these girls, which we are still not proved. So I think family history is important, but all the other associated things also have to be ruled out.
Environmental factors and genetics.
Yes.
There are so many things that work at the same time.
Yes.
Dr. Preeti also talked about adiposity rebound during your section, during one of the questions. Is this same as mini puberty?
No, this is not the same as mini puberty. Okay, so mini puberty is a phase wherein the hormones, the sex steroids are increased, specifically which starts just after birth, and it stays up till 1 to 1.5 years, during which you can see sometimes, appearance of the breast parts. In a very small child, in a newborn, or maybe somewhere early infant, what you see is the breast part, that could be a part of mini puberty. Okay, so this adiposity rebound is totally different. This is the increase in the BMI, which happens after a period of nadir. Okay, so usually the adiposity rebound, it happens around 4 to 6 years. And then there is another phase of adiposity rebound, which happens during adolescence. So nowadays, what is happening is, in children specifically who are low birth weight and SGAs or the preterms, they are having this adiposity rebound at an earlier age. Okay, somewhere around 3 years or maybe before 4 years. So that is probably a harbinger, or you can say a point which should, immediately point us that, okay, this is something which is not physiological, and you have to be very meticulous in monitoring the weight of this particular child. So as I said earlier, so prevention is always better than cure. So keep monitoring, allow the weight progression to be very gradual. Don't allow the weight, acceleration of the weight to happen very suddenly or very rapidly. So this is something which has to be avoided. Now, there is another point which I wanted to add is, sometimes infants who gain weight in the first year of life, they are also seen to experience this adiposity rebound. So in the first year of life, if you have an extremely important, extremely rapid weight gain, which happens specifically with the use of formula milk, that is something which we always discourage. Children should always be given for the first 6 months exclusive breastfeeding, followed by complementary feeding, which is based on the home-based diet. So we try and avoid all formula feeds. We try and avoid all food supplements. We try and avoid all diets like Cerelac or something like that for just encouraging the weight gain. So first year, if you have an exponential gain, that is again a risk factor for adiposity rebound, and also for early puberty and obesity later in life.
Yeah, especially if you're bottle fed, then usually it will result in the overfeeding. So
Yes.
that is very important concept. Sheila madam, there is a last question and there is one suggestion. What is your comment on the correction of secular trends for mid-parental height?
In last, again, 2 decades, the secular trend correction has been reducing. Before we used to take 10 centimeter, then it became 9 centimeter. Then now currently we are taking 6.5. Am I right? Yeah, 6.5. So I think that's how the world is moving. Everything is changing. So I think currently we are taking as 6.5.
And there is a very correct suggestion given by one of the participants that the school health checkup is the most important time probably when you can do the regular growth monitoring, and we can pick up these children who are having really these growth and puberty related disorders. So this is the one suggestion given by one of the participants.
Absolutely. And I would just add on that for all children who come to me regarding their growth problems, the first thing I ask is if you have any health record, and often specifically schools are monitoring the weight. But we need to, kind of emphasize on the importance of monitoring the height as well.
Yeah.
This is something which is lacking. And
They definitely do.
Yeah.
They definitely do. Unfortunately, what happens is every year they do it, and the sheet is every year different.
Yeah.
It is not a sequential like our growth charts. So they have every year they have one. They will send a book where the height and weight is done, but it is there in the hospital records, which is not school records, which is not available for the parents.
Yes.
And second thing, whoever has suggested, it is a good suggestion. But I have been trying for last 21 years since I started practice in Bangalore. Whenever we approach a school, they think we have some bad intention of doing it. They are not at all cooperative. So I think everybody, every area, every town, every village, where every big city, everybody has to talk to the schools and try to achieve this. I think.
Yeah, absolutely, madam. Yeah,
Many times I have tried. They always tell there is some intention behind it.
So you tell them
I
that
think it is the torch is in the hand of parents now. Like they only have to take it forward.
Yes.
when
That's
we talk to their principal or the authorities, and we tell them that we can just do a growth monitoring and we are not charging for it, then they become more skeptical about it, that why you want to do this free of cost and all that thing. I don't know how.
Yeah.
Yeah.
I agree completely.
But I feel probably now schools are started doing, but again, that what Dr. Sheila madam is talked about, it is actually an 1 year chart. So they will only get the details of only 1 year chart. The previous report card will go in the drawers every time. So that is the biggest problem with that. Yeah. So thank you very much, all the panelists for this particular webinar. So it is really a privilege to give vote of thanks and listening all of you since last 1.5 hours. I think the messages, whatever you are giving, these are all our common questions what we are talking about. So I especially thank both the experts. You can say all 4 are experts. So, but I think say the 2 experts for this particular webinar, Dr. Sheila madam and Dr. Preeti. I think that you really talked about the importance of growth chart. What Dr. Sheila madam has talked, that importance of growth chart is almost equal to vaccination. We are talking about the vaccination. I think that line is very important to percolate. That we are talking about the vaccination. Similarly, the monitoring of growth charts and pubertal assessment is similarly very important. Dr. Preeti, you really talked about all types of growth chart that is available. You talked about the obesity, you talked about the pubertal assessment. And I feel, personally, I feel whenever you get these pubertal problems, probably you need a pediatric endocrinologist to get consultation. Probably from a pediatrician point of view, he can just define that this child is having some problem. Probably he will require some special treatment. So thank you, Dr. Preeti and Dr. Sheila, for giving the special inputs. And at the same time, I thank both the moderators, Dr. Divya and Dr. Hari. I think the questions, whatever they prepared, I think they really gone in the base of those questions, that what are the common questions people ask in general. So I think we are able to answer all those questions. I also want to thank our webinar who are doing the live webinar this time, the RX events, and Ankit for making this possible, and ISPAE's team for keeping this continue in spite of many difficulties. But I think we are really able to continue with this for the second year continue. And last but not the least, all the participants who joined as a parents, as a doctors. And the only message I just want to give, other than thank you very much, that they should follow all the guidelines, all the discussions what he had in their day-to-day practice. So thank you very much and very good night.
Thank you.
Thank you. Thank you.
Thanks a lot. Thank you very much.
Thank you.